And good afternoon, everyone. 12:30 the time. Other Brian, you're in the house, aren't you?
I am here.
It's great to have you here
Thank you.
because I don't know what BD's doing. Yeah, like we don't know what he's doing. But anyway, it's we know what the Dr. April and Dr. Kyler, we know what they're doing. They're going to talk about stuff.
Pelvic health.
Always pelvic, always health. And this will be good. So what are we going to talk about today, ladies?
So today we really just wanted to talk about patient stories and just offer hope to other people that may be dealing with similar issues and letting people know that they're not the only one.
This is my favorite one. When you talk about stuff that has really happened to people around here and you kind of take care of it. This is great. Brian, have you ever been involved in this kind of stuff?
No.
All right, this is a great thing. It's like this stuff really happened, and you fix it, and it's awesome. Let's see what we got.
Yeah, and I always say, like, if our patients are listening, we're not calling you out specifically. We're not giving away any HIPAA information. So these are just patient stories. It could be anybody. It could be your neighbor.
Sure.
That's right.
It could be anybody. So there you are.
The first one I wanted to talk about today was I'm currently working with her still, but she came to me. She was urinating every 20 to 30 minutes during her daytime. She was getting up about 10 plus times a night, so it was really affecting her.
That's really hard to get anything accomplished
You
during
really
the day
should only
and
be
night.
getting up 0 to 1 time, maybe 2 a night. So yeah, it was really affecting her. She had been to several providers, tried all the tests, all the medication. Nothing was helping. She actually ended up having a provider just tell her, well, I guess just wear like an adult diaper while you're out and you don't have access to a bathroom and just use that because I don't know what else to do with you.
That doesn't seem like a great answer.
No, we actually hate that answer. Yeah. We hate anything that has to do with using any kind of incontinence product because that's just kind of masking your symptoms and it's just kind of a cop-out. So she started working with me. She's been working with me for about 6 weeks now. She had a lot of pelvic floor overactivity, a lot of tension just kind of through her hips and her back and her abdomen. So we've been working on all of that. After just 6 weeks, she's now only getting up 3, maybe 4 times a night to go to the bathroom. So that has been a lot of improvement. And she's now able to sit through a whole movie without having to get up. That was one thing that she was really sad about with her kids. She couldn't go to the movies with them because she was getting up every 20 minutes to have to go. And it was really distracting for her. So now she's able to sit down through a whole movie and be able to go and not be miserable. That was another thing, was that she can do it and she can do it with ease. So we're still working together. She's still got a ways to go, but she's doing all this conservatively. She's not on any medication.
Very good.
She's not having to wear pads or diapers. She's able to get through her life without those things happening now.
I like this story here. And you think about all the problems somebody has. And you've talked about sometimes where a lot of people just think there's one reason for this, like maybe your muscles are not tight enough to hold everything. This was the opposite, right? It was
Correct.
too tight.
Correct, yeah. And that was something that people had told her, like, well, you should probably just start strengthening the pelvic floor, strengthen the hips or whatever. And she had tried that, and that had made it worse because that's the opposite of what she needed. So, yeah, she's working on relaxation and doing, which sometimes seems opposite to people. But, yeah, once you get them going on that and they see the symptoms and the results, then they're really happy.
Very interesting.
Yeah, that's one of the things that we talk about is a lot of people, in childbirth classes, everybody just thinks the pelvic floor, they think of Kegels. And I've said this on here before on the radio, but you need to see a specialized pelvic floor physical therapist who's doing an internal exam to figure out what you actually need to be doing with those muscles. Because for a lot of our patients, it is not strengthening and doing Kegels. For a lot of them, it is relaxation and reducing tension through those pelvic floor muscles that connect to the hips and connect to the back.
Yeah, Kegels may be good for you, may not be good for you. You better find somebody who knows a little bit about it to get you pointed in the right way.
Yes.
Yeah. So come see Dr. Kyla or Dr. Katie or myself.
We'll tell you.
You'll take care of it.
The other thing I kind of want to talk about, just in general, I've been seeing this as a trend lately. A lot of my second, third, fourth time moms who have seen me for pregnancy prep and then they come see me postpartum have said that their recovery postpartum has just been so much better than when they didn't do anything during pregnancy. One of the things we like to talk about is how much money we spend on prepping for a wedding and prepping for those days, but we spend nothing for prepping for having a baby. So make sure that you are actually preparing your body. That's going to be a marathon. Having a baby, it's not easy. Your body goes through a lot in a very short period of time, so it's really important that you get in. And it can look just as simple as only seeing us 1, maybe 3 times a month during pregnancy. We'll give you the exercises that you need. We'll kind of check in with you on and off. Our goal is to check on mom. A lot of times people are very concerned about baby, which is important, but nobody's asking mom the questions that she needs to be asked. And that's something that we're really big on. We want to know how you're sleeping. We want to know how you're feeling, and we'll help you get through pregnancy. And then postpartum seems to be a lot better for those people.
Very good. April, you just had a kid just not what, a couple months back?
It's actually been 9 months now.
Oh, has it been that
Yes,
long? I was
Seems
thinking-
crazy.
It's
I
been
know.
9 months, and I did do pelvic floor therapy with Dr. Kyla.
Very nice.
During pregnancy and postpartum. And we haven't really come out with it yet in all the details, but we are offering in 2024 a pregnancy and postpartum membership.
Oh, very nice.
So our goal is for women when they find out that they're pregnant is that they call their OB, but they also call our office and say, okay, I need to get started with you guys in second trimester. And then we space it out through the rest of pregnancy and postpartum so they're getting care for their bodies.
All right, so something new coming up for
Yes.
Yep.
2024.
Stay tuned for that.
Yes.
Yep.
Very good. So far, two things, like a lot of you take care of the pregnant ladies, and after they have the baby, it's all right. We're doing good stuff there. What else we got? These are great.
So, yes, I have a couple of patient stories as well. So recently, a woman that I have actually just reduced her frequency to just coming in 3 months now. So she's no longer coming weekly or monthly. She is doing fantastic. She came in with the complaint of pain with intimacy with her husband since her last child. So about 20 to 30 years
Oh,
ago,
my.
she's been dealing with pelvic pain. Her and her husband just thought this is how it has to be. And then I think she heard us on the radio.
Well, there you go.
Like,
It doesn't have to be that way.
Yep. And she's like, wait, I can actually do something about this. So now she is back to pain-free intercourse, and she is back to exercising without any pelvic floor complaints. She was doing an exercise class where she could feel like a heaviness pressure down in the vaginal area, and she's able to exercise now without feeling any discomfort or anything down there.
Very nice.
So that is one. And then another patient I recently had who is actually a past healthcare worker. She came in for one of the free screens in November, and she was dealing with chronic low back pain, SI pain, and sacral pain. She completely stopped working out due to fear of back pain and instability in her SI joints. And I've only had her for 4 visits now. And she is already back to an exercise class because one of her things was like she was just terrified of exercising,
Sure.
scared that it was going to flare up her back pain. But she is now exercising again, and she is already having pain-free intercourse, and she's already feeling more stability in her SI joint. She literally told me this week, this is the best I have felt in 4 years.
Oh my gosh. Well,
So,
my
and it's only
goodness.
been
It's only
4
taken 4
visits.
weeks.
Yeah, 4
and
visits in there.
it's been a month because her screening was back in November.
Wow.
So, I just love being able to offer patients encouragement and hope. Like if you've been dealing with low back or hip issues for months or years and you've tried, general physical therapy or chiropractic care or injections, whatever it may be, and you're not getting the relief you need, I always say you're probably missing half of the picture. Like the pelvic floor, there's internal pelvic floor muscles that are actually hip muscles as well that can only be assessed internally. So I always say just give our office a call if you're dealing with issues and that part has not been assessed.
All right, you can check it out and get to the process. Very nice. Well, these have been awesome, and we found out you're just helping people left and right, men and women as
Men,
both.
women, and kids.
And kids.
Yep.
So if
Yes.
you are dealing with any kind of symptoms in that general area or just even your whole body, it wouldn't hurt to get in touch with you guys and get something started. How's the best way to get in touch with you?
Yeah, so you can reach us. We are Effingham Pelvic Health and Wellness. We are on the corner at Evergreen by Builder Supply and Equity. Best way is honestly to give our office a call, 217-705-5077. But you can definitely follow us on social media. We're very active on Facebook. We're on Instagram. We have YouTube. And we also recently came out in the past month with a private Facebook group for kind of Effingham County, surrounding counties for women only, kind of like a support group for pregnancy, postpartum, and pelvic floor issues. So you can find all that information in our classes on our Facebook page.
Very nice. Very nice. All right. And you can look at our interview we just did
Facebook
on
Live.
Facebook. You can click on there. You guys are tagged on there and it goes right to your Facebook page. You get all that information there as well.
Yes.
And you can see all these interviews on your YouTube channel, right?
Yes,
Yes.
we've been putting them all on there. And I don't think we're back on the radio until after Christmas. So I hope you guys have a Merry Christmas.
We hope you do
Yeah,
as well.
you too.
Yeah.
Thank you.
Indeed. Oh, they liked our new backdrop too. They thought
Yes,
that was
we
pretty
did.
awesome.
It's lovely.
Good job, Patton.
That is pretty cool. All right. Well, thank you both very much. Keep doing what you're doing, and we'll see you in 2024.
Perfect.
right,
Thank
thank you.
you.
Brian, I'll talk to you later.
All right.